Imagine waking up one morning trying to get out of bed and realizing your legs just won't move like they used to. It's not sudden. It's years of stiffness, neglect, and tiny warnings we often ignore. But what if just one daily stretch could change all that? What if it could protect your freedom, keep you walking, and keep you out of a wheelchair, even past 70? This one habit might be small, but the impact? It could be life-changing. If you care about staying strong, independent, and pain-free as you age, make sure to hit the like button and subscribe. We're building a community that values wisdom, health, and support. And your voice, your questions, your story, it belongs here. Many seniors believe that ending up in a wheelchair is just a natural part of aging. But doctors and physiotherapists often point to something else: weak hip flexors, tight hamstrings, poor balance, and joint stiffness. These are the hidden culprits that slowly reduce mobility, not just old age. Over time, when the muscles that lift your knees and support your lower back weaken, simple things like getting out of a chair or stepping over a curb become risky. You start avoiding movement. Then your muscles weaken even more. It's a cycle, and one that leads far too many older adults into walkers than wheelchairs. Stiff joints and tight hamstrings limit how far you can move your legs, making walking shorter distances harder. Many people don't even notice how much mobility they've lost until they fall or start shuffling instead of walking smoothly. Doctors often recommend gentle stretching and targeted strengthening, even just 5 minutes a day, to maintain function. Small exercises like seated leg lifts, gentle hamstring stretches, or balance holds can activate the very muscles that protect your independence. Balance also declines with age, especially if it's not trained regularly. But it can be improved, even in your 70s or 80s. Studies show that seniors who work on balance and mobility experience fewer falls and are less likely to need long-term mobility aids. The key is not waiting until you lose your strength to try regaining it. Prevention is possible, and often just a few minutes of daily movement can mean the difference between walking on your own or depending on a wheelchair. The psoas major is one of the most important and most overlooked muscles in your entire body. Tucked deep inside, it connects your lower spine directly to your upper legs. Every time you lift your knee, walk upstairs, stand from a chair, or even take a simple step forward, the psoas is involved. Doctors sometimes call it the hidden core because it silently powers the movements that keep you upright and mobile. But as you age, especially after 50, this critical muscle tends to tighten and shorten from too much sitting or lack of stretching, and that's where trouble begins. When the psoas becomes tight, it starts pulling on your lower back and pelvis. That leads to poor posture, back pain, hip discomfort, and an unsteady gait. Some people feel like their legs suddenly don't move the way they used to, or like they're leaning forward without meaning to. Others experience difficulty standing up straight, especially after sitting for a while. These aren't just general signs of aging. They're often direct symptoms of a stiff or shortened psoas. Fortunately, there's a specific stretch that targets this muscle directly, and it can make a powerful difference. Known by physical therapists as the psoas stretch, or sometimes the hip flexor stretch. It gently opens the front of the hip, lengthening the psoas and relieving the pressure it puts on your lower spine. One common way to do it is by kneeling on one knee with a cushion, keeping the opposite foot flat in front. Then gently shifting your hips forward creates a stretch along the front of the thigh and deep into the pelvis. Done correctly and regularly, even just 1 to 2 minutes per side per day, this movement can improve walking posture, ease lower back tension, and restore your ability to move freely. Many older adults who incorporate this stretch into their routine report fewer aches and greater stability when walking. Some doctors recommend adding this stretch to daily habits, especially for those who spend long periods sitting or who notice new tension in the hips and back. While the psoas might be hidden from sight, its effects are anything but. Keeping it healthy can be the difference between walking upright with strength or shuffling with pain and stiffness. To safely perform the psoas stretch at home, start by finding a soft surface. A yoga mat or carpet works well. If you have knee sensitivity, place a folded towel cushion under your knee for comfort. Begin by kneeling on the floor. Bring your right foot forward so that your right knee is bent at a 90-degree angle and directly above your ankle. Your left knee remains on the ground behind you, creating a gentle lunge position. From here, gently shift your weight forward into your front leg. You should begin to feel a mild stretch in the front of your left hip and thigh. That's your psoas area. Keep your upper body tall. Don't lean forward or arch your lower back. Tuck your pelvis slightly under by gently pulling your belly button inward. This small movement helps target the stretch precisely where it's needed, deep in the hip, rather than just along the thigh. Hold this position for 20 to 30 seconds while breathing slowly. Do not bounce or push into pain. After holding, slowly return to the starting position and switch sides. Repeat 2 to 3 times per leg. If kneeling is too difficult, you can modify the stretch by standing and placing one foot behind you on a step or low chair, then leaning gently forward while keeping the back leg straight. For seniors with limited flexibility or balance issues, using a chair or wall for support is helpful. Place a chair nearby to hold for stability, especially when transitioning in or out of the lunge. If you have had hip or back surgery or chronic pain in those areas, check with a doctor or physical therapist before beginning. Consistency is key. Even gentle daily stretching adds up over time, helping reduce stiffness, improve posture, and support steady walking. This stretch isn't about perfection. It's about preserving freedom and movement as you age. Done safely and with care, the psoas stretch can become a simple but powerful tool for protecting your independence. When the psoas muscle is neglected, the body starts to compensate in ways that slowly wear it down. This deep core muscle connects your lower back to your legs, acting as a major bridge for walking and standing upright. Without regular stretching, the psoas shortens and tightens over time. As it tightens, it pulls on the lower back and tilts the pelvis forward, creating poor posture, an unnatural gait, and chronic stiffness. Studies have shown that a tight psoas is directly linked to increased pressure on the lumbar spine. This can result in persistent lower back pain, especially during standing, walking, or getting out of bed. Over time, this imbalance also weakens surrounding muscles, particularly in the hips and abdomen, reducing core stability. As strength and stability decline, so does balance. Doctors warn that older adults who don't maintain flexibility in this area are at higher risk of falls, especially if they also struggle with joint pain or muscle loss. Many real-life cases show a gradual shift from slight discomfort to walking with difficulty, and eventually dependence on walkers or wheelchairs. What seems like a minor stiffness today can quietly lead to serious mobility issues tomorrow. Neglecting. The psoas doesn't just impact one area, it disrupts the whole chain of movement. The loss of smooth motion, confidence while walking, and balance can take away independence. And once that happens, regaining it becomes much harder. Regular, gentle stretching of this one muscle can make the difference between living cautiously or living freely. At 74, many people start to slow down. But for some, that slowdown turns into something scarier: instability, stiffness, and eventually, the fear of not being able to walk unassisted. That's exactly what doctors saw in a woman named Margaret, a retired librarian, who began experiencing severe hip tightness and lower back pain. Simple things like walking to the mailbox or getting out of a chair became exhausting. Her doctors warned her that unless something changed, a walker, or worse, a wheelchair, could be in her future. But instead of accepting that decline, Margaret began a daily stretching routine focused on one key area: her hip flexors, specifically the psoas muscle. With the guidance of a physical therapist, she performed a modified psoas stretch every morning, holding it gently and gradually improving her flexibility. It wasn't dramatic at first. But after just a few weeks, she noticed less pain when climbing stairs. A month later, she was walking longer distances without needing to rest. Her balance improved, her stride grew stronger, and the chronic back pain that once forced her into long periods of sitting began to fade. By the 6-month mark, her doctors were amazed. Not only had she avoided mobility aids, but her posture and confidence had also returned. What made the difference? Consistency, and focusing on the muscle that most people overlook. Margaret's story is a reminder that aging doesn't have to mean surrendering independence. Sometimes the smallest daily habit, done with care and purpose, is enough to turn the tide. Stretching can be beneficial at any time, but for seniors, timing can make a big difference in how the body responds. Many experts recommend stretching in the morning shortly after waking up. Overnight, the body tends to stiffen due to reduced movement. Gentle morning stretching helps loosen tight joints, improve circulation, and signal the body that it's time to get moving. It can also boost energy and reduce the risk of stiffness-related pain throughout the day. However, evening stretching also has its benefits, especially for those who experience tension or muscle soreness after daily activities. A calming stretch before bed can relax the nervous system, ease joint stress, and even support better sleep. What's most important is to avoid stretching right after meals when digestion is active, and to never force cold muscles into deep positions. If stretching in the morning, start slowly and allow the body to warm up. Ultimately, the best time is the one you'll stick with consistently, whether it's to wake up your body or wind it down. One of the most common mistakes seniors make with stretching is trying to force flexibility. Overstretching can strain muscles, irritate joints, and lead to small tears, especially in areas already weakened by age or arthritis. It's important to remember that stretching should never feel painful. A gentle pull, mild tension is enough. Going beyond that can do more harm than good. Another frequent error is poor posture during stretches. Rounding the back, locking the knees, twisting awkwardly, can place unnecessary stress on the spine and joints. For example, bending forward too far without support can cause a sudden loss of balance or increase pressure on arthritic hips. Some seniors also forget to breathe properly while stretching, which can lead to tension instead of relaxation. The key is slow, steady movement with proper alignment. Use support if needed, like a chair or wall, and don't compare your flexibility to others. Your body has unique needs, and respecting its limits helps avoid injury and ensures the stretch works where it should. Staying well hydrated is one of the simplest habits that can significantly improve your stretching results. Drinking enough water helps keep muscles and joints lubricated, reducing stiffness and making stretches more comfortable. Adding a warm compress or heating pad to your hips or lower back before stretching can relax tight muscles, increase blood flow, and prepare your body for movement. After stretching, gentle walking is another great habit to complement the stretch, helping maintain mobility and preventing muscles from tightening again. These small, consistent practices work together to enhance flexibility, reduce discomfort, and support overall joint health, making your daily stretches even more effective.